Welcome to Barnstable Today. I'm Nick Cortez. Just a reminder that full-length meetings, special events, and every program we air here on Channel 18 can be viewed online. You can check it all out in the town's video archives at town.barnstable.ma.us. Well, you may not know this, but in terms of 30-day survivability of a severe heart attack, there is no better place in Massachusetts that you can be cared for than here at Cape Cod Hospital. That's really true. And today, we figured that we'd take a tour of Cape Cod Hospital where we follow the path of a heart attack patient from the time he or she gets off the ambulance until the time that critical decisions are made that could potentially save a person's life. So come on inside. Let's take a tour of Cape Cod Hospital. Well, before anyone's even admitted into the emergency room, a guy like this is the person that helps you out first. This is John Talon. He's a firefighter paramedic for our Hyannis Fire Department. John, thanks for spending a minute with us. So talk to me a little bit about what happens when a patient has a heart attack. What is it that you have to do to make sure they get here safely? Okay, well, first they call 911, then we respond, do our basic assessment, the vital signs, and go into a more advanced procedures like IV oxygen, do an EKG to determine where the heart attack is occurring, and we can give appropriate medications to treat that heart attack. And also the most important thing is we do a cath lab activation, which gets the whole entire cath lab team here at the hospital ready, knowing that they have a critical heart attack patient coming in. So when that happens and you actually get to the hospital, what's the relationship like between you and the medical staff here to make sure that that transfer happens seamlessly and the treatment keeps going? Here at Cape Cod, it's excellent. Really is. They normally keep the patient on our stretcher and we wheel them right down to the cath lab, so there's really no delay in transfer in the ER right here. So it's a pretty easy thing then to do your job because they're helping you out on their end of things. Oh, definitely, too. Yeah. Well, we find ourselves now in the Cape Cod Hospital Emergency Center, and joining us is Liz Kelly, the nurse manager here. Liz, thank you so much for being with us. Thank you. Today we're talking a little bit about what happens when a patient finds himself or herself in the midst of a heart attack. And here is obviously the first stop. Tell us a little bit about what ends up happening when a patient first arrives here. Okay, well, hopefully the patient is coming in by rescue. And if they are, the EMTs would have started some protocols, one of which would be to take an EKG on the truck, and if they see changes in that EKG that would indicate a heart attack, they would call us. And the first thing they would say to us is activate the cath lab. So if that happens, and it often does, they will be right through here. We may not even take them off the stretcher that they came in on, and they'll roll right down there. The ER doc will have a look at them on the way down, but the cath lab will be ready, and they will receive them. The other way they can come in, of course, is through triage. If they walk in, if they walk up to the triage nurse and say, I'm having chest pain, we will not stop there. We will bring them right back in, we will get them registered in the room, and we'll get them their EKG. 90% of the time we get it within 5 minutes of them coming in. Now, one of the great statistics about Cape Cod Hospital is that it's the #1 hospital in Massachusetts for 30-day survivability of a severe heart attack, and that's incredible because I think that kind of bucks a lot of people's perceptions of what Cape Cod Hospital is all about. How do you explain such a great level of success like that? Well, it's just relentless pursuit of quality, and in this case, for us, the quality is moving that patient through here to the cath lab, because time is muscle, and every minute counts. When you're having an occlusion to your artery in your heart is not getting oxygen, and the muscle is dying. So the sooner we get you into the cath lab, get that blockage removed, the better chances you have. How can you attribute the success here, though, as opposed to any other places, like, say, a larger hospital in Boston or something like that? Well, I think, we have dedicated staff. We're dedicated to process improvement. When we look carefully at our data, we give that feedback to the staff on a regular basis, and then we say, what can we do to make it better? We want to make sure that every patient gets to the cath lab. It's a 90-minute door-to-balloon time is our goal that's been set by the state. We exceed that. And it's because I think we really get on the problem and make sure that
we meet that goal 100% of the time.
Well, it's certainly, you talk about it in a very easy way, but it's no easy task, to be sure, and we thank you for spending some time with us.
Okay, thank you.
So now we find ourselves inside one of the cath labs here at Cape Cod Hospital, and this is where some rapid decisions are made that really mean a lot in somebody's life, and here is somebody who's very, very good at making those decisions, Dr. Richard Zelman, the Director of Interventional Cardiology here at the hospital. Dr. Zelman, thank you for joining us.
Well, thank you so much for being here with me. I really appreciate having the opportunity to speak with you and to show you what we do here. We've been engaged in this new cardiac catheterization laboratory where we really have the ability to intervene and to save many patients' lives, as we've been doing for over a decade now. In fact, less than 12 hours ago, in the middle of the night, we were here with a whole team of physicians, nurses, and technicians working on a very young man who had had an out-of-hospital cardiac arrest as a result of very severe coronary disease. This patient was cared for by the emergency medical personnel in incredible fashion. His life was actually saved by them as his heart had stopped, and he was brought here very rapidly, right into this very setting where we found that his artery that went around the side of the heart was completely blocked off due to blood clot and plaque, which is what causes most heart attacks. And literally within minutes, we were able to reestablish blood flow through that artery to a very large part of the heart and to minimize the amount of damage that occurred to the heart muscle.
How rapidly does something like this happen? How fast do you have?
Well, really, once the artery has been blocked for more than 20 to 30 minutes, permanent damage occurs almost always. And the less time that the artery remains blocked, the less damage occurs. It can take only seconds for that artery closing off to cause a lethal arrhythmia, as occurred in this patient where his heart actually stopped. And without the rescue squad there to restart it with electricity, he would have suffered cardiac death. But instead, he's actually upstairs doing much better right now, and there's a good chance that he'll be leaving the hospital setting with no permanent residual from that.
That's really unbelievable. Can you talk to us a little bit about what we're looking at here?
Yeah, these are the coronary arteries which lie on the surface of the heart muscle. And with our setting here in the cardiac catheterization laboratory, we're able to take X-ray pictures as we inject the dye down the arteries, and we can find which artery is blocked and missing, and then we can engage it with special devices that we call catheters and place tiny little wires and balloons to reconstruct the artery with stents, which stay there permanently.
And is this a permanent solution to cardiac arrest, or is this something that is a decision that gets made quickly and then more long-term treatment starts after that?
Well, really, the most important thing for patients who survive an event like this is for them to alter their lifestyle. This was a patient who smoked several packs of cigarettes a day, really did not get proper medical care. He had high cholesterol and high blood pressure, all of which are very significant risk factors for heart disease. Within our setting, we concentrate on all of these risk factors so that when patients go home, their therapy is optimized. We give them as much help as possible to stop smoking, to control their blood pressure and cholesterol, to begin exercise, and to begin a more healthy lifestyle that will hopefully help keep this from happening ever again. This patient was extraordinarily fortunate. He's extraordinarily fortunate to be in the setting that we have here on Cape Cod, where we have the lowest mortality rate for 30-day victims of heart attacks of any place in the state. And in fact, we've had the lowest mortality rate during many parts of the last decade of any place in the country.
That's an unbelievable statistic, and today has been fascinating for us, and I certainly hope fascinating for you out there. Dr. Zelman, thank you very much for joining us.
Thank you.
As you've heard mentioned a number of times during this show, Cape Cod Hospital is the best place to survive a heart attack. But there's a lot more that's done very well at Cape Cod Hospital. To learn about that, visit capecodhealth.org. Well, that's all we have for now. I'm Nick Cortez, and we'll see you next time on Barnstable Today.